Well, the greater Helena area is seeing some serious impacts to businesses, schools, and the healthcare system as COVID cases rise.
MTN's John Riley takes a closer look at what's going on.
Lewis and Clark County has seen a significant rise in COVID cases in recent weeks. There are more than 450 active cases as of Wednesday, which is currently higher than Gallatin County. Area businesses have been feeling the COVID burden, with numbers still significantly down for many of them.
But the restaurants are still suffering. They, at best are doing 50 to 75% of normal. 50% is breaking even. So, that's a tough go for them.
Some area businesses have needed to close for a period of time after COVID exposure, and big money-driving events for downtown like Parade of Lights have been reduced in scope or canceled. On Wednesday, St. Peter's was treating 12 COVID hospitalizations, with ages ranging from 20 years old to over 65. At the current pace of new cases, running out of beds is a real concern for the hospital. Nurses and doctors are also a finite resource, and right now St. Peter's is seeing an increase in medical staff needing to quarantine.
It's inevitable that these active cases in Lewis and Clark County have our employees as family members and friends and contacts. And so we're seeing that every day, people that have to be quarantined and isolated for 2 weeks. And that makes it very challenging for us to keep going and keep everything open fully for this community and fulfill our obligations to keep everybody safe and well.
Dr. Harkins believes one of the big reasons for increased cases in the community is people are tired of COVID and have become lenient in following guidelines. She warns that unless things change, unless people are more diligent about wearing a mask, there will be dire consequences.
We know that light is at the end of the tunnel. This is not a forever thing. But we need to save as many lives as we can between now and then, not just COVID lives, but heart attacks, strokes, complications from diabetes, kidney disease, liver disease. Those are all patients that need care right now too. And the staffing constraints that we have will affect them just as much.
Well, Montana saw another jump in COVID-19 cases today with 624 new cases reported. That brings the state total to more than 25,000 cases, and more than 8,700 of those are active cases.